This summarizes the survey, the proximity census survey that is going on in this presentation. So, are you too close? Are you sitting too close? How much have you been observing the social distance and so forth? So to be able to detect some of this or to support that kind of question, there are these gadgets that can be mounted anywhere. In that case, it's mounted on a hand sanitizer facility. You can also use it to assess utilization of services and so forth. So they provide contact detection, not necessarily contact, but close proximity. They can be assessed to use interaction between individuals, services, actual use of resources and so forth. So the little thing that is circled in red there is a sensor, exactly what you have in your card, right? That means the lady who is doing the hand washing there is also using a similar gadget, and the two are speaking to each other. This is an example, exactly what is in there. They have different technology that they use: inductive, capacitive, ultrasound, optical, infrared, and Bluetooth as well. So these gadgets have been used in different type of studies, animal health, tracking contacts between rabies, but lately I think they have also been used in human activities and studies. They have a wide application. They have many advantages. They're resistant to physical environment challenges, and we keep those that are in the industry keep adapting to those. So in there, those are in cases which can be used in difficult environments and so forth. The little tags that you see there in that picture are also for labeling, so that when you're using them, for example, in social interaction services or assessments, you can track children, those that are used at a family level, for example, one that is sensing a child interaction with another child or with the mother, the caregivers. So utility can be social contacts, outreach activities, patterns of disease spread, contact with services as at the indicated area, but also in rehabilitation services. In terms of efficacy, they are once of cost because they don't have to be online all the time, but you can upload the data later on. They're relatively affordable. The costs have been coming down over time. They're time saving. You can imagine contact tracing based on human beings, but these can be used in these kinds of sensors, but also some in the recent advances, cell phones have been used and so forth. So the public health use of these proximity sensors, tracking nosocomial infections in hospital environments, but also adherence to sanitation facilities. Doctors may know the hand washing before surgery and so forth. COVID-19 tracing infections in general, tracking patients during mass casualties, wash aspects, and other utilization. In Malawi, we are also integrating these with proximity, the proximity sensors, with another study on participatory surveillance, where we are doing collecting symptoms, but we can also overlap now with the care practices of diarrhea symptoms and so forth, and the care practices in the household level. So they also don't come without challenges. I think the most important of those challenges are people have concerns of privacy. There are concerns of ethical issues and so forth. So those are some of the challenges that they come with. And I think the more recent challenge is people think that you can solve all proximity issues with this, but they're not all the time widely applicable. Thank you very much.